So this is skin disease and stigma in emerging adulthood and its impact on health development. So in this article, it says that the skin is the largest organ in the body and the most visible part of the body. And so skin diseases are mainly overlooked as cosmetics, but they're a prevalent health problem. And in the US alone, for example, there are over 31 million people with a form of eczema. So, and these skin diseases can range from mild to severe, which have a major impact on psychological health. Wait, no, yeah, psychological health. So, individuals with skin diseases, they experience embarrassment, taunting, which both can lead to isolation, and this can impair functioning. It creates social and like school and work limitations, and permanently like affects personality. So this article talks about eczema being thought of as common for childhood and prepubescence, but many people have relapses in adult life, and recurrence can be as high as 50%. So adults can definitely get eczema. Um, Emerging adulthood is a developmental stage in which like these people have more like identity crises and instability in their life, and they're more self-focused because like they're just starting to get into adulthood. And so these emergent adults who feel stigma may become pessimistic to like future possibilities, um, because they can become maladjusted to work and like their new social life. So skin related stigma impacts things like emotional distress. They create like substance abuse. They interfere with employment, and lack of social support and vulnerability are psychosocial stressors that come from having skin diseases. And so the purpose of this article is to like the purpose of this study was to look at emerging adult populations and the strength of relationships between like the specific skin disorders and like perceived stigma. So methods. They took a sample of like a big population of undergraduate college students like attending a large public university in California. And so data collection took place from November to December of the same year. I think it was 2006. And so they were given like self-report online questionnaires that they had to do. Demographic characteristics like age and gender and ethnicity were obtained. They were asked to indicate all of like their experienced skin disorders, and all of so basically all of the eczema and acne, like people like most people have had eczema and acne, so they were like the largest frequencies that they used them for statistical analysis because they were the largest frequencies. Yeah. So self-reported perceived stigma was resulting from the skin disorder was also obtained from them, and statistical analysis were conducted with an SAF software thing. There was descriptive statistics that were obtained to describe the skin disorder. Um, Frequencies were provided for perceived stigma, and indicators. Okay, frequencies were provided for the perceived stigma indicators, and they were separated by type of skin disorder. Okay. So, results. Of all the 303, okay, of all the students, 336 participated in the study. So, acne was the most common disorder, followed by eczema and then psoriasis, like as mentioned before. And then about 63% reported like um, about 63% reported discussing their condition with a healthcare professional. The most highly reported stigma um, connected to a skin disease was the perception that it was awkward to be touched or seen by other people. And then a substantial amount of people reported being bullied or teased. And then the last one was like being stared at by others. They were finding it difficult to find a romantic partner. they their disease was affecting their social life. So basically, these emerging adults perceive stigma as a result of their acne and eczema in several domains like employment, social events, romantic relationships, and self image. And this study supports previous literature that suggests that visible skin diseases are associated with perceived stigma among adults.